All right, let's dive into one of the trickiest topics on the NCLEX, musculoskeletal meds. But forget about trying to memorize endless lists of drugs. I'm going to show you a framework that builds real clinical judgment, and that's the skill that's actually going to get you those passing points. So let's start with the absolute core concept. The NCLEX, honestly, it doesn't care if you've memorized a dictionary of drug names. It tests one thing and one thing only. Can you connect a medication to a patient's safety and their function? That's the entire game right there. And listen, the stakes here, they're incredibly high. On the exam, and way more importantly, at the bedside, missing a critical side effect isn't just about losing a point, it's about risking real patient harm. This right here, this is the key that unlocks so many of those tough questions. It's not about what the drug is, it's about what you do because of the drug. That's nursing judgment, and that is exactly what we're going to focus on.
So for the next few minutes, you're going to get a little preview of exactly how we at Exam Coaches help you build this skill, turning what feels like a super complex topic into a simple, effective strategy.
Okay, first let's talk about the big problem. We call it the memorization trap, and it's where so many well-prepared candidates end up getting stuck.
Does any of this sound familiar? You've got your muscle relaxants, your anti-gout meds, your anti-arthritics, and they all just kind of blur together. You memorize this huge list of side effects, but you can't for the life of you spot the one that actually signals a real emergency. That's the trap, memorizing facts without a system to actually apply them. So, here's the crucial shift in thinking you need to make. The NCLEX rewards a completely different set of skills. It rewards your ability to see risk before it happens, to monitor for the right things at the right time, and to act safely and decisively. All right, let's put this framework into action. We're going to start with muscle relaxants.
First up, what do they even do? Well, it's pretty simple, actually. They act on the central nervous system to help relieve those painful muscle spasms. So think spinal cord injury, multiple sclerosis, that sort of thing.
Now, look at how we've organized this. Instead of just some random list of side effects, we link them directly to a nursing priority. So if the drug causes CNS depression, your priority is assessing for things like dizziness and hypotension. See? This structure immediately tells you what to do.
And that leads you right into an NCLEX-style question. A patient's on a muscle relaxant, they're feeling dizzy. What's your priority action? See, it's not just about knowing the side effect, it's about prioritizing their safety.
Okay, let's keep the momentum going and see how this framework builds. Next up, anti-gout medications. Their purpose is super straightforward. Get those uric acid levels down, either by making less of it or getting rid of more of it. Simple. And once again, it is all about priority actions. To prevent renal stones, what's your key intervention? Push fluids. To avoid triggering an attack, your patient education has to focus on diet and avoiding things like aspirin. Every single point is an actionable nursing intervention. Let's try a little mini scenario. Your patient's on allopurinol and suddenly gets a rash and a fever. Now, this isn't just some minor side effect. This could be signaling a life-threatening reaction. Our framework trains you to spot these huge red flags instantly. Okay, now let's apply this same logic to a really big category, anti-arthritic medications. We're going to zero in on a major player here, methotrexate. This is a perfect example of why priority monitoring is so important. We know methotrexate can cause bone marrow suppression. So what does that mean for you? It means you are watching those blood counts, WBCs, platelets, like a hawk, and you are assessing for any little sign of infection. So when your patient on methotrexate tells you they're feeling tired and bruising easily, your brain should immediately go, click, potential bone marrow suppression. Your priority is to assess for other signs and get a look at those labs fast. Finally, let's look at the framework for osteoporosis medications, because these have some very specific safety rules you just can't afford to miss. Let's talk about bisphosphonates like alendronate. The number one risk here is esophagitis. So the most important part of patient teaching isn't just what to take, it's how they take it. It has to be on an empty stomach with a full glass of water, and they have to stay upright for at least 30 minutes. This is not a suggestion, it is a critical safety instruction. And here's the test. Your patient reports jaw pain and has trouble swallowing. Those are massive red flags for serious problems like osteonecrosis of the jaw. Your first action has to be recognizing that danger and intervening immediately. So we've just walked through 4 different drug classes. Now let's pull it all together and reveal the unifying principle behind all of this. You know when you're studying and your page looks just like this, a total storm of terms. Syncope, pallor, edema, it's just overwhelming. But here's the secret. The NCLEX is not asking you to memorize the whole storm. It's training you to spot the lightning in that storm, the specific terms that signal immediate danger. And that skill, right there, is the difference between passing and failing.
And here it is, the unifying principle. It doesn't matter if you're dealing with acute muscle spasms or chronic arthritis. Your job as a nurse is always the same. Monitor for adverse effects, recognize complications early, and prioritize the right, safe intervention. That is the heart of the NCLEX.
Because at the end of the day, this isn't just about training for a test. It's about training for the floor, for the reality of being a safe, competent nurse. Inside Exam Coaches, we don't just teach you medications. We train you to recognize complications. We train you to pick priority interventions. We train clinical judgment to the NCLEX standard, which is the standard for patient safety. Please remember this. When you're staring at an NCLEX question with 4 plausible options, the answer they are always looking for is the one that represents the safest and most timely action for that patient. Look, this was just a small glimpse into how we break down and simplify these complex topics. The full, in-depth framework for musculoskeletal medications and everything else is waiting for you inside the platform.